Everybody, it's Dr. Khadisha, your board certified emergency medicine physician, and I'm here. We'll wait and see if some folks get into the room. So just in case you don't know who exactly I am, I'm Dr. Khadisha, your board certified emergency medicine physician and author of the best-selling book, Help Us Help You in the Emergency Room. It's what an ER doctor would tell you if she only had the time. And now in the age of COVID-19, with the emergency rooms filling up, people need this book now more than ever because it gives you an insider's view of what happens in the ER and why we need what we need, why there are the delays, why we ask questions, over and over again, why the nurses ask one set of questions, the doctors ask the same set of questions, and a consultant might ask the same set of questions. This book is meant for you to help us help you in the emergency room. And you can get that book at www.helpushelpyoubook.com. And let me grab a copy of that while we wait. Hey, DeJarvis, thanks for coming in. Okay, I'm just going to step out. And actually, it's the anniversary. I think March 1st was when this book first came out. March 1st last year. And I've been working so hard in the ER. I haven't really been promoting it like I probably should, but it's definitely needed. The folks who have gotten it, and hundreds of people have gotten this book, and they all say that they have used the advice in this book, and it has made their emergency room visit that much easier. And I know we're in the age of short attention spans, and we like to see pictures more than words maybe, and this book is very thin. It's broken down into just 5 stages. The first being like before you even need the ER, things that you can do while you're perfectly well, and that's the best time to get ready for an emergency room visit. So before you even need the ER, like knowing where exactly your nearest ER is, what kind of services they provide, where the proper entrance is, things like that. And then, so it's what to know before you go, what to expect on arrival, your actual ER stay, and the treatments, the results, and after the ER. So you see it's just it's very simple, 5 stages, and it's got a bunch of pictures in there and short topics, and they're all based on questions, concerns, and complaints that people have presented me with over the last 20 years that I've been working in the emergency room. So yeah, in the time of COVID, people definitely need to know what this book contains so that you have less frustration and maybe even less of an ER stay and less of a bill should you have to go to the emergency room. Okay, so let's see, we'll just give it another minute or so, and I want to talk about what we might expect to see as far as our new normal now that the federal social distancing guidelines have been extended to April 30th, and it's only April 2nd. And honestly, I wouldn't be surprised if those guidelines continue past April 30th, just the way things are still escalating. Don't be surprised if they extend past April 30th. So, if you have airline reservations and things like that early in May, like I do, you might want to see what the cancellation guidelines are and things like that. So, and let's see here. So we've got a couple of people in here, and I'll tell you, I did venture out today to go to some essential places like the bank and the grocery store. So, I do have some observations that I can make as well. Okay, so let's just see, and then, just playing this song in honor of the TikTok that's been keeping a lot of us entertained during this period. Okay, so let's see if a couple other folks get into the room. Yes, shout out to Dr. Ken, who had his book launch yesterday. His book is called Mental Blocks, and go check out his webpage at drkenrichmond.com. Okay, so we'll just get a couple more minutes. Okay, so yeah, I'm so excited to discuss what's been going on today. We'll get started, okay? So a couple of things that I noticed today early on were that our head of the National Institute of Allergy and Infectious Disease, Dr. Anthony Fauci, has been getting death threats, and it wasn't elaborated on why. CNN just mentioned that he's had to increase his security detail due to these death threats. I think a lot of people are frustrated, and folks are wondering, if they're being told the truth. We're being told, one thing, and then the next week another thing might be told, say, like masks. We were told initially we don't need to wear masks out in public. We don't need to wear masks unless we have symptoms. Now, more and more, we're being told that, yeah, we should consider wearing masks in general. The general public should wear masks even if they don't have symptoms, because it's becoming more of a concern that folks are passing on the coronavirus, COVID-19, even without symptoms. And people can spread it, can pass it on even before they can pass it on even before they develop symptoms. So it's not like people are intentionally spreading it. They have no symptoms, they feel fine, and they could be spreading it to people and not even knowing that they are. So as I was out today, I did notice that more people are wearing masks. I saw a couple police officers wearing masks. I saw a woman who had like the full-fledged one with the two vents on the side there, and she was wearing gloves also while at the drugstore. But most people still aren't wearing masks. You go to the grocery store, the poor cashiers still aren't wearing masks. The customers are definitely within that safe distance of them, and they're not wearing masks. And so I let them know that the CDC is definitely re-examining their policy that folks don't need to wear masks. Like, that is being highly considered. So the new normal that we should expect, that's part of the new normal. So say you're at work, you're at home, and you need to leave home. You need to leave home to take care of some essential tasks like I have. Thank you to Jarvis. Right, yeah, more people are wearing the mask, and I'll go into that further momentarily. So say you're leaving home, you're leaving work. What should you have with you? Have your mask, sanitizer, and I would say your own pen with you. We have to sign a lot of receipts, things like that. And so, at the bank, you have to fill out your deposit and withdrawal slips, and, those little pens come through the tube at the bank, and, they're doing you a favor with that pen, but, they've been passing that pen to people all day. Why not have your own pen to sign those slips? So let's see. So DeJarvis is asking, do you have to wear an N95 mask to protect yourself from the coronavirus? Well, that's not the only way that you can protect yourself, but that is one way to protect yourself. I know not everybody has access to masks, and masks are more expensive now. Masks that cost a couple dollars are now being sold for $15, $20, $30. So other things you can do to protect yourself from the coronavirus is, number one, stay home. More and more states are being clear that they want us to stay home. They're telling all non-essential establishments to shut down business to discourage us from going out. No bars and pubs and things like that are open. Even my old classmate, Mayor Muriel Bowser up in D.C., I was told that she sent out some robocalls, getting a little heated, telling people to stay home. And I saw her on CNN saying, hey, the cherry blossoms will be here next year. Do not risk getting the coronavirus infection just to see the cherry blossoms. Okay, so stay home, wash your hands for at least 20 seconds with warm water and soap. Use sanitizer if you don't have soap and water available. Stay at least, some guidelines say 3 feet. Other people say 6 feet, like the World Health Organization has said 3 feet at one point in time. Other sources say 6 feet because of the distance for which the coronavirus infected droplets can travel should someone cough or sneeze. So there are multiple ways to protect yourself. Stay home, wash your hands, use sanitizer, and if you do have to go out, at least stay 6 feet away from people. So, but back to the mask. So say you have to head out and you have to catch the bus. I highly recommend wearing a mask, or even you can just wrap a scarf around your face or something like that. Anything is better than nothing. So have your mask, your sanitizer, and pen with you. Okay, so the Hunan Provincial Center for Disease Control and Prevention referred to a study done by Chinese epidemiologists that of a 4-hour bus ride. Okay, and a passenger got on who had the coronavirus infection, the COVID-19 infection to be specific. He got on and they managed to infect about 7 other people on that bus, one of them as far as 4 meters away, and 4 meters is about 12 feet. Okay, so that exceeded the safe distance of 1 to 2 meters, or being 3 to 6 feet that we've been discussing before. So in an area with closed windows and no AC running, they confirmed that in an environment such as that, the transmission distance of the new coronavirus infection could go that far. So their conclusion was that if you're getting on public transportation, definitely wear a mask, and wear the mask the entire time. Hey, Dr. Dietrich, thanks for joining me. Dr. Dietrich Gorman is America's relaxation doctor, and she and I, along with Dr. Carol Penn, do a healthcare discussion called Perspectives in Primary Care, and we actually discussed the new normal in the age of COVID-19 earlier this week. And just for those of you guys who didn't catch the discussion, I'm going to go over some of those topics. So we're saying expect to see more mask use. The Chinese are publishing studies saying that you have to we need to wear a mask to be safe, especially on public transportation. Okay, so say you take the bus, and definitely with Lyft or Uber, you should cover your mouth and nose as well. So say you go to the grocery store. Now at the grocery stores, don't expect to just walk right in. Sometimes you might. I went to Randall's grocery store in downtown Houston, and I was able to walk in. But if you go to the HEB 10 minutes down the road, they might have a line that has markings on the ground to make sure that you are standing at least 3 to 6 feet away from the person in front of you and behind you, so that they limit the number of people. They want to limit the number of people in the store also, so they have people at the entrance that watch who leaves and allow a certain number of people to enter at a time. Whole Foods did the same thing. So at the grocery store, expect that. Expect to wait in line. Expect to wipe your shopping cart off as you enter. Have your sanitizer handy. More people are wearing masks, and and when you're checking out at the register, unfortunately, the cashiers aren't wearing masks. I'm not seeing the cashiers wearing masks, and you'll have to use that little plastic wand to sign off on your bill. Be ready to sanitize your hands after using that wand. If you go to the bank, certain banks are handing out sanitizer. The tellers are handing out some small sanitizer containers, like Capital One is doing that. If you want to do any functions that require sitting at the desk with a banker, they might not have that available to you right now. You're not going to be able to sit at the desk a few feet away across a desk from someone for a 30, 45, 60-minute period conversing with them. The tellers are now saying we can handle certain things here, because they've got the plexiglass between you and them. So you might have to handle some inner transactions where you normally got to sit down. You might have to handle them standing up at the tellers, with the tellers. So movies. Okay, so what about movies? Are movie theaters closed? Well, I'm not seeing that movie theaters are closed, but companies like Universal Pictures have announced that their cinematic releases will be available to stream at the same time as their theatrical premieres, beginning with the Trolls World Tour on April 10th. So the studios are going to charge about $20 for you to stream it at home, but they're counting on the fact that you still save money watching it at home for $20 versus spending almost $20 per person to see it in the theater. So, and then also there's still some movies that are better left to the big screen. So don't worry, you're not gonna. Well, I should say, maybe you will worry. The Fast and the Furious is being postponed until next year. Okay, so, and they're hoping that this whole thing will be behind us, so that's why they're postponing it for so long. So, and I don't think that people are gonna just stop going to the theaters, because as we're seeing now, with officials begging people to stay home, people are having cookouts, birthday parties, they're still going to church. We Americans love our freedom, and it's expected that people will want to venture out to theaters and see films on the big screen when it's a bit safer. So back to church. Churches across the country are streaming their services, and a group of political scientists did a poll, and they found that of the churches polled, 17% of the churches were still holding physical service. Okay, now some churches are scanning their parishioners for fever as they enter, so at least they're doing that. But scores of parishioners are testing positive for the coronavirus. For example, in rural Arkansas, about 36 people who attended a church service came up positive for COVID-19. Okay, in a suburb of Chicago, 43 people showed symptoms of the virus following a service, and an additional 10 from that same church had tested positive as of Friday. And lastly, sadly, a Tennessee pastor died from complications of COVID-19. Pastor Tim Russell, a beloved pastor of the Second Presbyterian Church in Memphis, died Monday from such complications. And so what about dating? Tinder use is up, but the app is promoting the World Health Organization guidelines and our federal social distancing guidelines in the following statement. Social distancing does not have to mean disconnecting. We hope to be a place for connection during this challenging time, but it's important to stress that now is not the time to meet in real life with your match. Please keep things here, meaning on the app or social media, for now. And with pubs, bars, and many restaurants closed, at least to dining in, the number of possible locations to meet have greatly decreased, but you can still go to the park for now as long as you maintain your social distance. I do see people walking their dogs, still in the park, exercising, just walking around. And so if you're willing and able to keep at a distance, you could still possibly see that person at the park. Okay, and again, back to the masks. Maybe you could, wear masks and be a little bit safer, getting a little bit, just stay 3 to 6 feet apart. Okay, so back to the mask. Why are we talking about the mask? Why now? It's because, again, the people in China are saying we should wear the masks. The let's see here. The CDC director, Robert Redfield, was interviewed. Our CDC director was interviewed on National Public Radio, and he said, "I can tell you that about the data and this issue of whether or not to wear masks will be aggressively reviewed this week. It's being aggressively reviewed as we speak," meaning that was meeting Monday afternoon during the interview. And the former FDA commissioner, Scott Gottlieb, pointed to South Korea and Hong Kong, where there is success in managing their outbreak, and there is widespread usage of masks then. So again, George Gao, the Director General of the Chinese Center for Disease Control and Prevention, did say that the United States and Europe are making a big mistake with people not wearing masks during this pandemic. He specifically said that mask use helps to tamp down the risk presented by people who may be infected but aren't yet showing symptoms. So expect to see more masks. I've seen Louis Vuitton masks on Instagram already. Various rappers are already coming out with their own masks. Okay, so hopefully it'll be like a fun and fashionable thing. I'm seeing bedazzled masks on Pinterest. So I think people will find a way to make this fashionable and fun. So now a new topic, the nursing homes. A number of nursing homes across the U.S. have residents in them that are positive for COVID-19. And I've seen in some publications that those nursing homes don't have to be named. And so, that's causing concern amongst the public. So, that's another thing that you may have to expect as part of your new normal. So, healthcare and assisted living organizations have urged family and friends to stay away from senior living communities because of the concern for, again, people without symptoms spreading the coronavirus to our most vulnerable population. The Department of Veterans Affairs started the isolation strategy March 10th. They were barring outsiders from all 134 of their nursing homes and 24 spinal cord injury centers. And the exception was to this no visitors rule is when a patient is expected to die soon. And this guideline is now in place at all nursing homes nationwide. Now, I do know someone whose grandmother recently passed, and he and the family were not able to go and see his grandmother. But unfortunately, COVID-19 is for the elderly. It's a killing machine. In these facilities, many times the average age is, 70s, 80s, 84. Everybody with underlying medical conditions. So when you combine those factors together, you're dealing with perhaps the greatest challenge that these nursing homes, long-term care facilities, and assisted living facilities have ever faced. The government has told these nursing homes to cancel all group activities and communal dining. The residents and staff are being actively screened for fever and respiratory symptoms, according to the CMS, the Centers for Medical Services, and but the frequency of that wasn't elaborated upon. So, so that's why there are a number of precautions being taken, and I know people are hurting because they cannot see their older loved ones, but these precautions have to be taken to protect them, to hopefully prolong their lives, and to protect the staff who are working there, because a visitor could come in who has no symptoms, and they could pass it on to the staff, who could pass it on to the people who live there. So, it's like a domino effect. So, so please be patient with the nursing facilities. Please be patient with the nursing home staff. This is really to get a hold of the transmission of the coronavirus. Now, and I know people are concerned that that the residents are cut off from their loved ones. I've read stories of folks who live there who won't let anyone but their daughter shave them, or a woman who won't do physical therapy unless her husband is there to to cheer her on. But this is literally a matter of life or death. So do any of you guys have any concerns or other comments? DeJarvis says, yes, it's very hard to have a loved one in a nursing home during these times. And I really understand that, but we have to protect the staff there, and protecting the staff there is protecting the residents there. Hey Peter, thanks for coming in. Thanks for coming in. My friend Peter, his wife is a nurse in a nursing home. We want to protect her. We want to protect Peter's wife there also. We can't have people who are coming in with or without symptoms of coronavirus and passing them on to the staff. I don't want my girlfriend to get, to come down with the coronavirus. She has a large family. She loves her family. She loves her friends. And, that could easily pass on to other people. And so that's how this pandemic has been escalating. We, social distancing, it's people would say it's evil, but it's a necessary evil at this time. So, any other comments or concerns that, and I'll just look at some other things that I had found. Okay, so say the Brookdale Senior Living, it's a long-term care facility or company based in Brentwood, Tennessee. They've put a banner up at the top of their website so people can get more information, so that they're not surprised and frustrated when they come to these nursing homes. Okay, so if they're saying that the staff should use gowns, gloves, and face masks or goggles when treating ill patients. That's these are some of the precautions that they're taking. Residents suspected of having the virus should be placed in single rooms with closed doors. Dining rooms may be closed and meals delivered to the residents' rooms. And those who feel that they must visit any group living situation for older residents should be prepared for detailed questions. So again, I'm just trying to get you prepared mentally and physically for any attempts at visiting your loved ones in the nursing homes. And again, just in case you haven't heard it multiple times already, we worry about the elderly because many of them do have underlying conditions. Many of them have underlying conditions that compromise their immune system. Diabetes, heart disease, lung disease, cancer. Even if they are a cancer survivor, that they may still be weakened by that. Like we had an emergency medicine physician die in New Jersey. He was 60 years old, still working. I read, he was a great clinician, probably still full of energy and all. He was a 2-time cancer survivor, and he caught the coronavirus, thought he could recover at home. He thought he could recover at home, but he was 60, 2-time cancer survivor, and his symptoms got too severe too quickly, and he did not survive his infection with the coronavirus. So, and he was just 60 years old, just on 60, but he had made it through 2 bouts of cancer. So with our elderly, again, hypertension, diabetes, heart disease, lung disease, many of them were smoking for decades before they entered the nursing homes. Even if they haven't smoked for years, their lungs have sustained permanent damage due to those decades of smoking that might make them less able to recover from a coronavirus infection. So that's why we have to be so careful with the nursing homes. Also, even in an elderly person who might not have underlying conditions. And the one thing I've noticed as an ER physician, many folks who are up in age, they'll say they have no medical problems, and I have to ask now, when was the last time you saw a doctor? Okay, all right, you say you are, 60 plus and you have no medical problems. I have to make sure that they're still seeing a doctor. Many older people still have not seen a primary care physician, and they're just going on the fact that they feel fine. And so they figure if they feel fine, they don't have any risk factors that would make them vulnerable to an infection. And I'm saying you definitely need to get regular physical exams. By the time you're 60 years old, you need to be seeing a physician at least a few times a year, at least every 6 months for a physical. Also, so elderly folks who don't necessarily have medical conditions, say they really do see a doctor every 6 months or even every 3 months and they don't have any medical conditions, they still may not mount the same immune response as someone in their 20s or 30s or 40s. They could be really have a major infection going on and have a normal temperature. We may get blood work looking for increased white blood cells as an indicator of a significant systemic infection, and their white blood cell count may be low or normal. We've been taught that in medical school that you have to have a lower threshold of concern for the elderly because they might not mount that fever. Their blood work might not show signs of them fighting an infection. And that's even with older folks who are healthy. So I just wanted to go over these things here. So, things to expect for the new normal: more mask use, carrying your sanitizer with you, carry your own pens with you. If you're taking public transportation, definitely wear a mask and wear a mask the whole ride. Movie theaters are streaming new releases the same time as they are being released in theaters. The Fast and Furious is being postponed until next year so that hopefully we can see it on the big screen. And nursing homes are being a lot more restrictive with visits from family in order to protect the staff and to protect the residents. And on a darker note, just to end on that, funeral services. I lost an old neighbor of mine, a young man that I grew up with, recently passed away, and his family has to stream the funeral service. It's going to be such that all of us just click a link so that we can watch his memorial service. And this is up in the DC area. And I also know a funeral consultant down here who also said they are streaming funeral services now. So it might be that you can't even attend the funeral service for a loved one because of the social distancing guidelines. You don't want going to a funeral to lead to more illness and death. So all of us who went to this same school, St. Anne's, and the folks that he went to high school with, St. John's up in DC, we're going to have to watch his memorial service from somewhere outside of the church, because they can't have but so many people in there at at a time. So expect funerals to be like that. Expect social distancing at funerals. Now I got a notification about students from Texas Southern University who went to Mexico for spring break, and they came down with the coronavirus. So let's see here, what happened. Okay, so yeah, a number of college students from Tennessee State are in isolation after after going away for spring break. We still have to be worried about those young people. Hopefully the young people are heeding the warning that even if you feel fine with the coronavirus infection, you could still pass it on to your parents who might be in their 40s and 50s, and to your grandparents. So I'm going to look into that story a little bit more, and I hope that you guys write in the comments some topics that you want me to talk about. This has been a long discussion. Hopefully it wasn't too dry. Hey, Dr. Carol, thanks for coming in. Thanks for joining me. And thanks for joining me for this discussion of what to expect in the new normal in the age of COVID-19, with a special look at the nursing home and long-term care facility community. Again, I'm Dr. Kadisha. I'm your board-certified emergency medicine physician and author of the book Help Us Help You in the Emergency Room. It's a Amazon best-selling book, and this book is really important right now as people are streaming to the emergency room for cold symptoms, flu symptoms, coronavirus symptoms. Hopefully it's not coronavirus, and for all of the other things that typically drive people to the ER. This book is filled with advice that will help possibly shorten your stay, decrease your bill, and definitely decrease frustration, miscommunications, misunderstandings, and so that you can get the most out of an emergency room stay should you, your friends, your loved ones, or your co-workers need an emergency room visit. And you can get this book at www.helpushelpyoubook.com. Thank you so much, Dr. Dietrich. And I will, since we're spending so much time at home, I'll autograph the copy for you if you go to www.helpushelpyoubook.com and get your copy today. It has a lot of pictures, there's even some humor in it, and there's even a section in here where you can write down what we need to know about your symptoms and your medical history, and even that of a child that may come under your care and say you're not the custodial parent. So those parents who get their kids every other weekend, you need to get this book. Okay? So folks who are working with people who have medical conditions that might land them and you in the ER, you need to get this book. I see plenty of people who show up in the emergency room with their co-workers in the ER during the course of the workday, and they're anxious, they're frustrated, they don't know what's going on, and they don't know why what's going on is going on. Okay, so again, I'm Dr. Khadisha, your board certified emergency medicine physician and author of the book Help Us Help You. And you can follow me on Instagram, Facebook, and Twitter at Dr. Khadisha MD. That's DrKadishamD on Facebook, Instagram, and Twitter. And my website is the same, drkhadishamd.com. And on my website, I have a freebie for anybody who goes to the website that contains 8 essentials for surviving a medical emergency. Coronavirus or no coronavirus, the ER is still a busy place, and you want to be able to navigate it better than people who don't have this information. Again, I'm Dr. Khadisha. Please put in the comments anything that you would like me to discuss in the future, and please stay home and be safe. Bye.